Hey, what's up, YouTube world? Dr. Perry coming at you. And no, not to worry, I'm not going to do some kind of naked, shirtless selfie thing. I'm going to show you what these things mean that I've drawn on my neck. So I used a skin drawing pencil because I want to cover with you some superficial subcutaneous, which means very, very close to the skin, nerves that where they come out here, right, they can influence neck pain, shoulder pain, headaches, and stuff like that. So the nerves actually, when you see here, they're going to come out of the front here in these things called grommet holes. And where I want you to notice is how they branch out and how far down they go. They're going to go over the collarbone up to that upper pec region here. And you've got another one on this side, which comes down like that. All right. And these nerves are really important because, look, every time I turn my head, these nerves have to move. Every time I'm even talking, look, when I'm talking and I do this kind of motion, these have to move. And these nerves attach to other tissue below it. So the superficial nerves influence the deeper nerves. And these nerves very often cause pain in the shoulder, pain in the neck, pain in the nerves, stuff like that. And you have a lot of blood circulation in the skin. I mean, it has a ton more blood supply than it actually needs for itself. And hypoxia, which is the decrease in oxygen, decrease in blood flow to a nerve, causes an intense amount of pain in relationship to movement over time. So I want you to notice also how it moves whenever I move my arm. Right now, I'm going to show you a really quick, easy way that you can influence these. The key is you don't want to press really hard and push deep and just massage. Because when you do that, you're going to go past these nerves and go influence the deeper nerves. And this can send you into pain really fast, and then these nerves seize up. So what you're going to do is go really, really light. And I want you to notice here just how little it takes to influence where these nerves move and how they glide. Okay? And you'll check one side and check the other like this, and see if it's tender or painful. Most of the time it won't be. But if you have discomfort on one side of your shoulder or your neck, I want you to make sure you do both sides, because just because pain is on this side doesn't mean it's not from a problem on this side over here, because I know the body's interconnected, and the brain doesn't know the difference between right side and left side in relationship to how it moves. And what you can do is this. You can take two ways. You can do it by hand, but I usually prefer you to get like an elastic band like this. What can work really well is if you take those things that you use to open up a jar, like the jar opener or bottle opener type thing like that, that works really well. And I want to show you what it's going to look like. If you do it by hand, you put your hand on the side of your neck right here, and then all I want you to do is go up, down, front, back, circle forward, circle back, and then do kind of crazy 8 patterns. What you're not doing is moving your hand over your skin. You're putting your hand on the skin, and then you're moving the skin, which means you're gliding the nerve around like this. And you can see me do it the other way. Now, I know it's going to appear when you do it that, like, Doc, I'm not doing anything here because I can barely feel anything. That's the secret. That's the key, is that, you feel like you're not doing anything. And most people just go too hard, too fast, too deep. So do the same thing on the other side. Just put your whole hand on the lower side of your neck, go up, down, front, back, circle forward, and then do like a crazy 8 patterns in there. If you want to go a little deeper, then you can take like an elastic band like this, and look, I'm going to put it on the side of my neck, and then what that does is it grips and glides on this skin, so it gives a little bit more skin drag. You can even hold the skin now and then move your arm like this, or move your head. Then you do the same thing over here. All right, up, down, back, forward, circle back, circle left. Do about 60 seconds on either side. And notice what kind of changes that you have and how you can move your arm, how you can move your head, how you can move your back. I'm really trying to teach you guys that you don't have to hurt somebody to make them get better. You don't have to press really, really deep and go to the center of the earth when you do manual therapy work. You go nice and easy and try to influence these. Be nicer to your body, and I will show you some stuff back and kindness. If you want to learn a lot more about this stuff, you can join my exclusive membership site on StopChasingPain.com, where I show you over 600 videos of really cool stuff you can do to help yourself feel better. All right, thanks guys for tuning in. If you haven't done so already, hit the subscribe button below so you can see all the new stuff coming out all the time. Take care.